Lifestyle medicine is the use of lifestyle interventions directed at the treatment, management, and prevention of disease.
Hey folks, Dr. Keel here, and I want to take a few minutes to talk about the hormone testosterone. We've all heard of it. We know that it is linked to building muscle and athletic performance, and that people sometimes supplement it. But what does it really do? Where does it come from? What other effects does it have? And this video is designed for folks without a major scientific background who want to learn more about testosterone. One quick point before I get started. Testosterone does have effects on the human body from conception all the way through puberty. However, I'm going to focus specifically on the effects of testosterone in adults in this video. Testosterone is an androgynous steroid hormone. The term androgen or androgynous refers to any compound, natural or synthetic, that binds to receptors that promote or control the development and maintenance of male characteristics. Steroid refers to a broad class of compounds with a very specific structure, typically composed of 4 6-carbon rings, of which testosterone is just one example. And the term hormone refers to any signaling molecule created by the body that exerts its influence on other organs of the body. Testosterone synthesis is derived from cholesterol, like all steroid hormones. This is why you will hear some folks advocating for certain fats, namely monounsaturated and polyunsaturated fatty acids and saturated fat in your diet to promote hormone synthesis. For example, a decrease in saturated fats is associated with a decrease in serum testosterone. The individual steps of synthesis are beyond the scope of this video. In men, testosterone is synthesized primarily in the testicles, or testes. Specifically, a class of cells called Leydig cells are responsible for their synthesis. Women also produce testosterone, but at lower amounts, and this occurs primarily in the ovaries in cells called thecal cells. Both genders also produce small amounts of testosterone in the adrenal cortex, which sits above the kidneys, and from our skin. Testosterone is transported around the body, primarily bound to sex hormone binding globulin, which is also responsible for carrying around other androgen and estrogen hormones. Regulation of testosterone synthesis is somewhat complicated, but I will briefly illustrate it to make an important point. It starts in the hypothalamus, a gland in the brain which detects low testosterone and releases something called gonadotropin-releasing hormone, or GnRH. GnRH acts on another gland in the brain called the pituitary gland, which releases 2 hormones, luteinizing hormone and follicle-stimulating hormone. These 2 hormones travel down to the testicles and tell the Leydig cells to begin producing more testosterone. And here's where it can start to get confusing. If your body's testosterone level goes down, all of these hormones will go up in an attempt to stimulate more testosterone production. If your testosterone level goes up, all of these protestosterone hormones will actually decrease because they are detecting elevated testosterone. This is termed a negative feedback loop and is how many of the hormones in the body are regulated. The important point here is that if you supplement testosterone for an extended period of time, you can suppress your regulatory hormones to the point where they do not get released at adequate levels and hinder your body's ability to synthesize testosterone naturally. Testosterone acts on 2 clusters of bodily function primarily, androgenic and anabolic. Anabolic, again meaning promoting building, promotes muscle mass and strength, modifies body composition, decreasing body fat, increases bone mineral density, increases red blood cell production in the kidneys, and also affects the prostate. Testosterone can be converted into dihydrotestosterone, which promotes prostate growth, and it's why our prostates tend to get larger as we age. The androgenic effects include aiding in erectile function, libido and sex drive, and normal sperm development and fertility. It does have some other effects. It can promote estradiol synthesis. In adipose tissue, testosterone is converted to estradiol, which is the primary female sex hormone. Men do require some estradiol for healthy function. However, obese men can significantly increase their estradiol levels because of their adipose tissue, which can cause development of female features and suppress testosterone synthesis. And there are some psychological benefits as well. It can help reduce the risk of depression, improve mood, and it may stave off dementia and improve cognitive function. So you might be wondering when testosterone tends to decline. In women, they go through something called menopause, which is the cessation of the ovarian and uterine cycles and loss of fertility. Typically, this occurs around the age of 51 and happens rather abruptly, measured in months. There is no such event that occurs in men. Our serum testosterone levels peak around the age of 30 and decrease about 1% a year as we get older. In otherwise healthy men, there is no specific point at which our testosterone levels suddenly drop off. This slow and steady decline in testosterone is referred to as andropause. The signs of low testosterone are very much the opposite of what the effects of testosterone are. So when your testosterone begins to decline, you can see a decrease in bone mineral density, erectile function and libido, red blood cells, muscle mass and muscle strength, and a sense of well-being and cognitive decline. And you can also see a change in body composition accompanied by an increase in body fat. And I want to briefly talk about the side effects of steroid supplementation. And before I say anything, let me be clear. Under no circumstances should you be ingesting or injecting steroids in your body without the supervision of a physician. The long-term consequences can be very severe, and they include liver dysfunction, coronary artery disease, increasing the risk of heart attack, decreased sperm count and fertility, decreased production of hormones that promote testosterone, decreased production of natural testosterone, too many red blood cells, altered lipid profile, including increase in LDL and decrease in HDL cholesterol, sleep apnea, enlarged prostate, and behavioral changes, including irritability, aggressiveness, and nervousness. And so in summary, testosterone is a steroid hormone with primarily androgynous function. It is synthesized from cholesterol in the testes. Synthesis is regulated by testosterone levels and glands in the brain, namely hypothalamus and pituitary. It affects the body in two primary ways: anabolic, including increasing muscle mass, bone density, decreased body fat, increased red blood cell production and prostate size, and androgenic, including erectile function, libido, and sperm production. Normal decline begins around age 30 and is about 1% per year. Signs of low testosterone include decreased muscle mass, increased body fat, decreased bone mineral density, and cognitive decline. And the side effects of testosterone supplementation are significant and should not be undertaken without the supervision of a physician.
AI Clinics, no excuses, just results. Give us a call for a free consultation with one of our clinical advisors.